vascular system?
Pipe fluid.
Pump, pipe, and fluid. So Edward said something clever, he just didn't know it was clever, about the diuretic. So the diuretic makes you pee, and pee, and pee. So how does that lower your blood pressure?
You have less liquids.
You have less circulating volume because the pee comes off the plasma. The pee comes from the kidney, which filters your blood, so you're pulling, kidneys are pulling that plasma off the total blood volume, thus decreasing your volume. That's how diuretics lower your blood pressure. Metoprolol is a beta blocker. So the beta blocker decreases contractility, or the squeeze of the heart. So that works on the heart, right? And then what's the other part? You have the third part, you have the pump, you got the fluid, the pipes. So your losartan or
Valsartan.
SVR.
Zestril, those drugs decrease the peripheral vascular resistance, all your blood in your periphery, your veins, they dilate, thus lowering your blood pressure. So it's interesting. To lower the blood pressure, you need to work on one of those three, or more than one of those three pieces of the circulatory system. I take lisinopril, Zestril. It's a decreases peripheral vascular resistance.
ACE?
It's an ACE inhibitor.
See how I got that? I was like,
You're an ACE guy.
Good shit, man.
ACE inhibitor, just because it may come up on registry, that classification of drug is really the number one drug that causes angioedema.
Claritin.
Popsicles. Claritin's an H2 blocker. Benadryl's an H1 blocker. Whatever. Fun with drugs. But cardiogenic shock, it's the pump. Hypovolemia, it's the fluid. Distributive, it's the vessel. Obstructive, it's obstructive. It's a thing. But when you get a patient in shock, I'm always trying to figure out, is it a pump problem, pipe problem, or a fluid problem? Because I have stuff to do for each one of those. So you have to come up with two reasons, what would two things that would cause cardiogenic shock, pump failure. I've already talked about them earlier. I talked about one of them. Did you say MI? MI is the big one, heart attack. CHF usually is hypertensive. That's what's causing all that fluid to leak out, is hypertension. But if it gets so bad that the pressure drops, pulmonary edema with low blood pressure is cardiogenic shock. So if you say, when answering this question, if you put pulmonary edema, just make sure you put with low blood pressure. But heart attack is number one. It's that literally the pump is failing because it's infarcting. What else? It's part of the heart. You can have valve disruption. And then there's two more. You guys haven't had to think about this for a few months. If the heart rate gets really, really fast, like 200, the blood pressure drops. If the heart gets really, really slow, like 20, 30, 40, the blood pressure drops. So those are called dysrhythmia, like abnormal heart. You can put abnormal fast, abnormal slow heart rhythms. Do you guys remember why in really fast or really slow the blood pressure drops?
Really fast. Ventricle block filling.
compensation.
Or the atrium filling.
That's part of it. So do you remember the heart rate times stroke volume is output times resistance, size of the vessels is blood pressure. And really, really fast, it's the heart squeezing so fast that the ventricles don't have time to fill very well. And really, really slow, it's literally just a math problem. They're filling proper, but there's only so many stroke volumes, heart rates per minute, and that number goes down. So in both cases, you either speed it up or slow it down to get normocardiac. Normotensive. You just have to remember two. Really fast, really slow, heart attack should be the no-brainer for causes of cardiogenic shock. Or valve. And that's a no.
Give me that next one.
Oh, that's not shock. Psychogenic, neurogenic.
Sensitive,
Oh.
right?
Neurogenic and psychogenic.
There's one more.
I said it's the P. It says septic, neurogenic, asthmatic. Yeah.
So give me a description, or give me an example of each one of those. What's an example of septic shock?
Just any virus.
Mental health?
Old lady with a
What kind of
catheter,
infection?
UTI infection.
So urinary tract, elderly, very common, and
Yeah.
people that are incontinent. Pneumonia,
Mm-hmm.
those are the two most common. Urinary tract infection and pneumonia. And so, I've had pneumonia probably since I've known you
Like
guys. How come I didn't get septic?
Different.
A little different.
Yeah.
But so sepsis, it's just that widespread bacterial infection that decreases the, not permeability, but decreases the integrity of the vasculature, so it dilates. So of that triangle of the cardiovascular system, it's a pipe problem. And then just for one last little bit about shock on the, it's the most common type of shock, by the way. It's not a test question, but sepsis. It's a itis, right?
Mhm.
Pneumonitis, neurogenic, it's probably the hardest one. Spine injury, take it a little bit further. The injury of the spine is so bad that it does what?
It
Vasodilates
doesn't tell you
everything
how
below
to
it.
increase heart rate.
Below the.
It does the opposite of increase heart rate, because the message isn't there, it's
Yeah.
cut. So in the absence of a message to compensate, to survive, everything just kind of slows down and dilates. And what's that message? What
C3?
nervous system? Say it.
C3, C4.
C5 stay around.
What's the
Vagus?
what nerve? Is it the peripheral nervous system?
Oh.
Central?
Shit. That's a
Parasympathetic?
Central.
Sympathetic?
Central.
This is a test question. Central nervous system's brain and spinal cord.
Yeah.
Sympathetic.
That's right. So, you know, that high degree of spinal injury decreases sympathetic tone. So everything just dilates out. Because the brain can't say squeeze, beat faster, clamp down. So the sympathetic tone is lost. That's on the test. Yeah, that's why they're at low blood pressure and heart rate's about the same, because they can't compensate. There's no message getting there saying beat faster. There's no message to shunt blood so they're warm or pink. Some people call it warm shock, but you don't see it very often in your life. It would be gunshot wound, stab wound, high speed, motorcycle or car crash. Bad luck for the patient.
Tamponade, embolism.
You look alright.
No,
Tension.
there you go.
Tamponade.
Don't be lazy.
Yeah.
Embolism. I don't know what the third one is.
There's three of them.
You
went wrong.
There you go.
I did.
Well, I mean, we did. You said two what?
I did three.
He said
Tension.
Neurogenic.
Tamponade and embolism.
Sympathetic block.
So when you, so is it a pump problem, a pipe problem, or a fluid?
Sympathetic what for
It's
neurogenic?
kind of all over the place,
For
it's
neurogenic
just
shock.
really not a bad
So
one.
spinal injury
There's an
plus
obstruction
decreased
in the
sympathetic
system.
tone.
Decrease sympathetic.
Sorry. Hypervolemic.
Bleeding, burns.
They're constricted. Yeah, the obstruction is, the
Burns and
obstruction is either.
Tension, tension, and
It's pushing up against the bleeding cava.
Diarrhea.
Pericardium is full of blood squeezing off.
Oh.
What do they say for hypovolemia?
Bleed, burns.
Vomiting, diarrhea.
Don't put that. If you guys put hemorrhagic, non-hemorrhagic, I'll give you half credit.
How
Yeah,
come?
non-hemorrhagic is so lame. That is.
Oh,
that
things
is-
lazy.
It
Where's
must be
diarrhea?
beneath you to say that.
Vomiting, diarrhea.
Just draw a picture of a popsicle.
Bleeding.
That's all four.
You get a quarter point for that. If you say you're already. Do not put non-hemorrhagic. That is so pathetic for you to put that.
It's in the book.
Spell it.
Huh?
Spell it.
You got it there, buddy.
So you said burns, but which one? Burns.
Diarrhea, vomiting, bleeding.
There you go. What are insensible losses? Not on the test. What's an insensible loss? Say again. Sweating and breathing, somebody who's in respiratory distress or breathing 60 a minute, you're burning all kinds of calories breathing that fast, so you get relative dehydration. Is this workload?
Burn calories breathing?
Yes.
Calories doing anything.
Burn calories just thinking. Mnemonics?
Oh,
Yeah.
oh, I got this shit down.
That's who.
Jesus.
Oh my god.
Nope.
Well, no, that's for ultra.
That's cool, right?
What?
There you go, it's both. It's GCS and AVPU. If you thought AVPU, that's kind of like your primary exam,
I'm
GCS
responsible.
would be more in the secondary. They're both good.
Okay.
Yeah. There's gonna be scenarios with the GCS that you're gonna have to calculate.
Oh.
Okay,
OPQRST.
PQRST.
what if I got shot in the upper arm? Entrance, no exit, good distal function. You can do OPQRST on the pain.
VCAP.
You bleeding?
Viola.
You're not gonna do OPQRST, it's pain, hurts.
Both.
Yeah.
You can do a rapid
Medical
trauma
thing?
assessment, no?
OPQRST.
What's the two, like, why do we do the mnemonic? Why do we, OPQRST is correct, why do we do it? What's the purpose of it?
To find out what the origin of the
That's right, I got a gunshot wound in my arm, do you need to ask me what was I doing when it came on? Does it hurt when you know what I mean?
Yeah.
You could, I would say, not to be a complete dick about it, you can ask a 1 to 10 just to gauge how things are going. That would be perfectly reasonable. But it's really the chest pain and the abdominal pain where this really has the most utility. Okay, good, that's good.
Apgar?
And you know what it is off the top of your head?
Appearance,
Pulse,
Appearance, pulse, grimace.
Activity. That's muscle tone, and then the last one was.
Respiration.
Good. Okay. There's a couple of neonatal resuscitation questions. I'll go over them tomorrow. Don't stress about it.
still function?
Distal function.
CMS.
CMSTP, I would take CMS, but know that I think that you're weak if that's all you put. CMSTP is what I taught you, CMS is what everybody else teaches you. If they're weak, temperature, color, moisture, sensation, temperature, pulse, color, moisture,
Temperature, pulse.
So in the CMS, C gets color, temperature, and pulse, all is wrapped up in C. I'm okay, I'm not gonna just know that internally I'm gonna look at your picture and snicker. It's okay. Nope. It's the final. Nobody cares except me and you, your family, your future offspring.
Taste.
Okay, bro.
Taste.
And once again, why do we do paste on short of breath?
Find the origin.
And is that a big deal? They're
Yes.
short of breath. Give them oxygen. Take them off. Set them up. Loosen restrictive clothing. Take them to the hospital. I think it's a big deal.
Yeah.
Because as you get further into this, you're going to treat the different breathers differently. One treatment can hurt the other badly.
Tips. Alcohol, epilepsy, insulin.
Keep going.
Overdose.
Overdose, uremia, trauma, infection, psychogenics, poisons, and alpha.
Come on.
Stroke, syncope, and
So your patient has, you guys come on scene and the patient clearly appears to be unresponsive to you. You go up and there's no obvious bleeding, the airway is noisy. What do you do?
Open it.
And so you, based on what you know, you can either do the jaw thrust, modified jaw thrust, or the head tilt chin lift, head tilt neck lift. So you open the airway, and now the airway's open and clear, and they're managing secretions. The breathing is rapid and labored. What are you gonna do about that? Does that patient need oxygen, perhaps?
Yes.
So you can, and they're really big sick. So what would you do for oxygen?
Or the BVM.
NRB.
Fuck.
So you
Is
can.
it conscious?
But they're breathing rapid and labored. We'll say the breath sounds are, you hear them, but there's a little bit decreased tidal volume. So you can start with the BVM at how many liters per minute? 15 liters per minute. They have no radial pulse. They have a faint brachial pulse that's fast and regular. And their skin is pale, cool, and moist. You didn't do anything for circulation? Anything to do?
warm.
So are they in shock?
Yeah.
So what's the treatment for shock?
Keep warm. Oxygen transport.
Position, keep warm and oxygen, okay? Okay, so good. So this patient has no blood pressure that you can get, and they have an altered mental status, say their GCS is, I'll just pick a number, 10. It doesn't matter how it lines out, but they're altered. Do we do the AEIU tips on them?
No.
Blood glucose.
Why?
You want to make sure you want this life-saving interventions first.
We just did all that, right?
Oh.
Didn't we? Like, we opened his airway, we started giving him oxygen, right?
So the guy has no radial pulse. Does this mnemonic, is there utility in this mnemonic for somebody with no radial who's in shock?
No.
Right. So that's when you use it. You use it for somebody who has a blood pressure. Okay. If they don't have a blood, I just put that in there just as a filler. You should have a good look at that.